Welcome to Intelligent Healing by StellaLife. I'm Liz Lundry, a longtime hygienist, in-office trainer and consultant, and the clinical education manager for StellaLife. Today, I'm going to be going over why use StellaLife, the science behind StellaLife, and the many applications of the products, how you can incorporate these into your protocols. And I'll also be talking about StellaLife probiotics and Dentamedica supplements. With these products, you can elevate your practice by getting better overall clinical results and also seeing practice growth. Our mission is to improve people's lives by accelerating healing, relieving pain, and reducing the need for opioids. And we have thousands of clinicians using these products with their patients and hundreds of thousands of happy patients and customers using StellaLife. And we pride ourselves on customer service, and we have consistently high ratings from Trustpilot. Our products have won numerous awards. The StellaLife VEGA Oral Care Recovery Kit was awarded the top Best Healing Award from the Dental Advisor for 5 years in a row. And more continuums are having StellaLife as part of their protocols as they're teaching doctors to do surgeries, to place implants, because the instructors are using the StellaLife products with their own patients and are seeing such great results that they want to share that with their attendees. So with 17 years of research, we have an amazing oral care line. Our antimicrobial rinse, replaces chlorhexidine with no side effects, no burning, no staining. And it has many other applications other than just being an oral disinfectant. And it comes in a peppermint flavor as well as a coconut flavor. The coconut is not just a different flavor. It has twice as many protective ingredients and is very soothing, designed for those patients who are sensitive to mint. Our gel has multiple uses. It is a very powerful anti-inflammatory. It also provides analgesia. Both the rinse and the gel accelerate healing, and both are very soothing. In our recovery kit, it has a rinse, it has a gel, and it also has a sublingual spray, which again helps to reduce inflammation. It helps to reduce bleeding. So on the day of the procedure, there's a clearer field for the clinician. Less bleeding means there's less swelling and bruising, so more comfort for the patient. It also provides analgesia and even helps to reduce patients' anxiety. And this is a patented product. It is an innovative natural approach. All of the active ingredients are derived from plants and minerals, so they do promote wellness. Every clinician can benefit from having these products for your patients. And many patients are reporting that their lives have really changed with these products. So for surgical applications, ideally one would use the recovery kit. Again, by having them use this before they have the procedure, you're going to have that disinfected mouth. The patient's going to be much more comfortable and they're going to heal very, very quickly. For the non-surgical applications, we have the application of the rinse for dry mouth. We can use it for many other purposes as well. The gel is great on herpes simplex lesions. It's wonderful for canker sores, angular cheilitis. Any type of a lesion or surgical wound site will benefit from using the rinse and the gel. The gel provides pain relief within 2 to 3 minutes that lasts up to 3 hours, depending on the lesion and on the patient. We also want to make sure that if you're doing surgeries, if you're placing implants, that you can get the best possible healing and bone integration. So we have StellaLife Dentamedica as well to make sure our patients have the micronutrients and also, of course, the vitamin D and K to get the best bone integration. And for overall health for all of our patients, we now have StellaLife Probiotics, which is unique because it has an oral lozenge for an oral probiotic and a capsule as a gut probiotic, both of them in one box. So with the research that we have, this study was done at Bern University by Dr. Rick Myron and his team. In this study, they compared chlorhexidine to StellaLife, finding that there was a lot of toxicity with the chlorhexidine, none with the StellaLife, And this study showed that the StellaLife rinse actually causes the rapid growth of human fibroblasts. So with that rapid fibroblast growth, we're seeing a much more rapid collagen formation. And this is why we typically see a month's worth of healing within a week with StellaLife products. This study was done at the University of Texas, and here they compared the StellaLife rinse to chlorhexidine, to Listerine, and to saline, finding some toxicity with all of those other products. Again, no toxicity with StellaLife. And if you look at these samples here, this is the StellaLife sample, and here on the bottom, you see the fibroblasts replicating. There's a nice thick band of these fibroblasts replicating, great activity there. When you look at the chlorhexidine sample, we don't see any fibroblasts because we know that chlorhexidine kills fibroblasts, it kills osteoblasts, and it has other toxicities as well. When you look at the control, you see normal fibroblast activity, and you can see how much more of that we see with the StellaLife sample. This study was published in the AAP Journal of Periodontology. In this study, they compared the StellaLife gel with chlorhexidine, povidone iodine, and Periosciences AO gel, finding some toxicity with all of those, none with the StellaLife gel, and also finding that the gel also increases the growth of human gingival fibroblasts. As far as pain management is concerned, all our offices that are using our StellaLife products, especially the recovery kit with surgeries, are finding that they need to use less and less opioids. And this was reflected in this study and published in the Journal of Oral and Maxillofacial Surgery by Dr. Tatch, who found a continual decrease in the need for opioids in this oral surgery practice. And this study was done by Drs. Lee and Suzuki. Dr. Suzuki was a previous chair of the products panel of the FDA, and they got some recovery kits and used them for this study with patients undergoing block bone grafting. As you can see here, it's a pretty intense procedure. It's considered the most painful procedure in dentistry, and they got great results with not only accelerated healing, but how comfortable the patients were after this procedure was done using the recovery kit. So our pain management protocol, as you can see, does not include opioids. You would be using the recovery kit, which is going to provide a lot of analgesia. After the procedure is completed, you would apply the gel to the site postoperatively, which is going to offer more analgesia and other benefits. If the patients will take pain medication, they would just need to take your typical acetaminophen and Motrin combination and do that 4 times per day. And we do have instructions that we can give you so that you can give that to your patients. So when you dispense this to your patients, you will tell them, I'm going to give you this kit to use. This is going to be part of your procedure. It's going to help you heal much quicker, and you're going to be much more comfortable after the procedure when you use this. So we have done studies, microchem testing, and found that our rinses are both effective against these pathogens. The P. gingivalis, as you know, it is a keystone pathogen, and it is linked with many diseases of the body. By having the patients use the StellaLife rinse on an ongoing basis, we can help our patients not only get control of this bacteria to have a healthier mouth, but hopefully a healthier body as well. It is also effective against strep mutans. So if you're doing CAMBRA, the caries infection protocol in your offices, you would use the StellaLife rinse instead of the chlorhexidine, and then whatever remineralization or fluoride products you may be recommending for those high caries risk patients. And for patients that have dry mouth, they do tend to have higher caries risk. And with one product, they can hydrate as well as reduce their caries risk. And a 2-minute rinse with the StellaLife rinses is also effective against human coronavirus, and more offices are using this as a pre-rinse as well. So Dr. Scott Fromm, a periodonticist researcher with a Perio Implant Advisory blog, and he writes articles, and he wrote an article for Dental Economics about the use of the recovery kit to reduce the need for antibiotics during SRPs. And with the cankerosaurs, he wrote this article about the use of the gel. So when the gel is put on any lesion or a surgical wound site, it provides pain relief within 2 to 3 minutes, and that pain relief lasts up to 3 hours, depending on the lesion and the patient, and then the patient can reapply. This gel, when it's used on an aphthous ulcer, will not only get the patient out of pain, but it'll help that ulcer to resolve within 2 to 3 days rather than 10 to 14 days. So your patients that get canker sores, which can be excruciatingly painful, are going to really love you even more for having this gel available for them so they can be comfortable when they have these episodes. Here is a video from Dr. Michael Picos.
There's a 3-3-3 regimen we talked about. It's very impressive. Here's a typical V-plasty with Eloderm. Time 0, there's 5 minutes. Hemostasis is like boom, amazing. But keep gauze on it for a good 4 minutes by the clock. That's the key to low compression, and let it soak in, and bingo. Here's a case of just cytoplast over extraction sites. You know, again, tissue is beautiful, responds very, very nice. And then here's our typical, 48 hours later, that's what things look like. Very typical. It's amazing.
So hemostasis is another benefit of using the gel. It's always great to have a chair side. If for any reason you need hemostasis, you can put the gel on there and it'll help the bleeding stop very, very quickly. Looking at these studies, if you look here on the lower left side, this patient had extractions and immediate implant placement, this all on 6 case here. And the gel was applied with a swab at the end of the procedure. You can see within 40 minutes, the reduction of the inflammation and the bleeding. And on the upper right side here, this patient had a sinus lift and ridge augmentation, and the gel was placed only on the patient's right side. So when you compare the right side to the left, where there was no StellaLife gel applied, again, you see the reduction in bleeding and inflammation. This case here, this patient had extraction and extensive bone grafting, and this looks like it's going to hurt when the anesthetic wears off. She used the recovery kit, and this is what it looked like after 1 week. And what was really great about this case is the patient said she only needed to take 3 pills for the pain. So she had a great surgical experience. And when your patients have that kind of experience, they're going to tell their friends and send you referrals. So I want to go over the use of the products. And with the recovery kit, that is what we're referring to when we talk about the 3-3-3 StellaLife program. The recovery kit has 3 products that are used 3 times a day, starting 3 days before they have the surgical procedure. So in the box, you have a full-size StellaLife rinse. And when the rinse is used, either as part of the recovery kit or on its own, you want to make sure to tell the patients to shake the bottle to blend all of the ingredients. Each rinse comes with a little measuring cup, so instruct the patient to only use 10 milliliters of the rinse, and they should ideally rinse for up to 2 minutes. It's very soothing, it's very pleasant tasting, and if they've had a surgical procedure, there may be food particles they can't otherwise clean. The StellaLife rinse will just float all of those off. And when using any of the products, whether it's one or any combination of the products, it's important to tell the patients not to eat or drink for 20 minutes after using the products. So if they're using the recovery kit, the next step would be to put 4 sprays of the oral care spray under their tongue. So it's a sublingual spray. The ingredients in the spray are the same active ingredients as in the gel. And what we have in this formulation as a spray, it's able to get into the bloodstream sublingually, so that we're able to get these active ingredients into the bloodstream. And when we The final step in using the recovery kit after the sublingual spray would be to put the gel on the surgical site with a swab. So when we use all three products together with that sublingual spray and the gel too, we're able to treat the patient from the outside in as well as from the inside out. So all of the products, once they're open, should ideally be used within 60 days. Unopened, everything has up to a 2-year shelf life. In addition to using the recovery kit for surgical procedures, it's also great to be given to patients who have long-term well-established lichen planus or oral pemphigoid, and also patients who are undergoing cancer treatment. Patients that are going to go through chemo or radiation of the head or neck, they tend to get pretty awful lesions and very serious mucositis. But if they use the recovery kit before they begin their chemo or radiation of the head or neck, they will not get that type of mucositis or lesions to that degree. Generally, they're very comfortable, and then they can use the coconut rinse or whatever other products they like to use once they're going through their therapy, so they continue to have good hydration and minimal discomfort. So here's how your patients would use the products at home and how you would apply it chairside.
Well, to attach here, this is a case of all-in-6 reconstruction with immediate temporization. We're going to apply right after the surgery StellaLife VEGA oral gel over the surgical side with the suture line and then the vestibule. We bring the patient back 15 minutes later for delivery of the temporary prosthesis. Where we're looking at the soft tissue a week later, you can see the tissue is already responding very, very nicely.
So very simple to use, and another great application of the recovery kit and the StellaLife, other StellaLife products would be for scaling and root planing. So if you have an SRP patient coming in who's diabetic or they're a smoker or have other risk factors, or you're expecting there's going to be a lot of bleeding, or it's one of those patients who's just very, very sensitive, the recovery kit is the best way to go. Have them start using that 3 days before they come in for the first scaling and root planing appointment. Once they're finished with the products in the recovery kit, then they can then move on to using the rinse and the gel. And using the gel, having a chair side, there are many applications. And with the rinse, our hygienists are using the rinse for subgingival irrigation with SRPs and with perio maintenance. So you would just shake that bottle and then you put some of the rinse in an endo syringe and place that once you're finished as a final step with your SRP. And you can put the gel on top with a swab so that you can have additional analgesia, reduction of inflammation, reduction of bleeding for that patient after the procedure. And our offices that are encouraging the patients to use the rinse on an ongoing basis for daily oral hygiene are reporting that when they come back for their perio maintenance or their prophy appointments, they don't have the bleeding and the inflammation that they used to. So this is really beneficial to have patients use this again every day on an ongoing basis. So after the SRPs, the patient would use it, they can put the rinse on the sites with a swab, and then also put the gel on top to continue to accelerate more healing and to have them be very comfortable. So other applications include halitosis. So a lot of our patients come to us, the perio mouth, they have the bad breath, so they can use the rinse to eliminate those pathogens, as well as using the probiotics kit with that oral lozenge that is going to help to ensure the good commensal bacteria will be populating the mouth and outpopulating the pathogens, so we can really help to have them have fresher breath. Patients that have dry mouth can use the StellaLife rinse. The coconut rinse can be a better choice for patients that are sensitive, have a sensitive mouth, burning mouth patients, and you can use that coconut rinse. It's also a little bit more hydrating. So if they have extreme dry mouth after using the rinse, they can put a bit of the gel on their tongue, particularly if their tongue tends to stick to the roof of their mouth. So that's really helpful for those patients. If you should ever have a dry socket, the recommendation for that is, using the rinse and the gel. So you would apply the gel in the office, have that patient come in, and check and see how they do after about 10 minutes. And then you would dispense the gel, have them take it home, and they would apply it to that dry socket and use the rinse before, then apply the gel and do that 4 times a day. So that's going to get them out of pain, and it's also going to help accelerate the healing of that dry socket. Denture patients tend to have very dry red tissue, and they often will get lesions as well. So using the rinse on a daily basis is really a great idea for hydration, to keep that pathogen count down, and also just for their comfort. And then they can use the gel on any lesions that they may have. You can even have them put the gel in the denture itself. Patients undergoing ortho, when they have traditional braces, of course, get a lot of trauma from the brackets and the arch wires. So the gel is wonderful to provide relief for that. And because it's so hard to keep those areas clean, using the gel on a daily basis will keep that tissue healthy. And for patients that are in clear aligners, you can also dispense the gel when rotation is put on a tooth. Even with clear aligners, it can be really painful. So they can just put a bit of the gel right in the tray. And sometimes the trays can have a rough edge and can traumatize the tongue or the cheek. So it's great to have the gel on hand for that as well. This patient had lichen planus and was not getting relief from using steroids, and they have their own side effects. So she was given the StellaLife rinse and gel and got these lesions under control after a week, and also reported that she no longer had the burning that she had in her mouth before. So for a lot of patients, the rinse and the gel is all they need. Those who have got more stubborn, long-term, well-established lichen planus can use the recovery kit, and they may need to do that for a month before you get to a level of healing that they're comfortable with. And then they would use one of the rinses and perhaps the gel on a daily basis, because these are chronic conditions. And so they would continue to use this ongoing. Same thing for any oral pemphigoid patients. So the same protocol. And we will give you clinicians' guides for each of your operatories that are laminated, that have all the different procedures and conditions and which products to use for those different applications. This patient had this very painful mucositis and was given the recovery kit and used it for a month. And after that, got it under control and got out of pain as well. So with our pre and post probiotics kit, it is, again, phenomenal because we have the oral probiotics as well as the gut probiotic in one package. And the probiotics we know are healthy, good bacteria that we need. They help to control our blood pressure, control our hormones, and really make a difference with our digestion, our ability to absorb nutrients. They're really incredibly important. Unfortunately, because we don't eat a healthy diet, most of us, a lot of the time, and eat many packaged foods, maybe, we're really not getting these in our diet. And the probiotics need prebiotics. That's the food for them. So again, usually available in food sources that we generally don't consume enough of. So we've included those, as well as the postbiotics, which are the byproducts from the metabolism that these bacteria go through. So it is a spore strain, which means that it will survive the stomach acid and does not need to be refrigerated. So we have these essential strains in here, and they are a wonderful group that have many different functions. Again, the whole idea of using the oral lozenge is to increase the growth of the commensal bacteria, so they outpopulate the pathogens, so that we have control of bad breath. We can reduce the patient's risk of periodontal disease as well as caries. And then the gut probiotic, we want to make sure that we have a good digestive system and are really getting good absorption of the nutrients that we consume. And this really helps with that. So great to take a gut probiotic. So who should take this? Really all of us, because we don't always eat right. And our food sources not what they used to be. They do have a lot of unnatural ingredients, and sometimes there just isn't much of a presence of the good bacteria in our diets. So if we're going to be giving anybody a prescription for antibiotics, we should definitely recommend they at least get a good gut probiotic, but we can just provide that for them with our StellaLife probiotic kit. So anybody that's going to be going through SRPs, have that periodontal disease, anybody going through periosurgery, anybody with halitosis, all of these people will benefit. and they would use these ongoing on a daily basis. So again, with the halitosis, they can use the StellaLife rinse, and then after 2 hours, they can go ahead and use the oral lozenge to help with that. So they would use the gut capsule every day to get those probiotics in the system. And once a day, also use the oral lozenge, let it dissolve in the mouth. It takes about 5 minutes and it is pretty yummy. It's a nice strawberry flavor. So as with other StellaLife products, you don't want to eat or drink for 20 minutes after the lozenge, and you don't want to use mouthwash for 2 hours before or 2 hours after using the lozenge. We have StellaLife Dentamedica to ensure patients undergoing any type of bone grafting, any other type of surgery, that they have all of the nutrients they need to build bone. So we want to accelerate that healing. We want to make sure that they have the vitamin D and the vitamin K and the other micronutrients for the best possible healing. There's been a tremendous amount of research about the need for vitamin D. You can take a look at any of these studies by using the QR code here. And everything, the studies that are in this presentation are all on StellaLife.com under the research section. So you may remember a few years back, the AMA increased the minimum daily requirement of vitamin D because everybody was deficient. And if your patients are deficient, there will be complications with healing. So we know that you're going to be able to get more rapid healing if they have the proper nutrients there. If your patients are deficient in vitamin D, your implant failure rate goes up to 300%. So many offices are requiring evidence that the patient has very good vitamin D levels. And by providing Dentamedica, you can ensure that. You also will give them the antioxidants, the other essential vitamins that they need for best possible healing and ongoing to have healthy bone and soft tissue. So here, who would get this would be anybody undergoing dental surgery, any implants, any grafting. And after the surgery, after they finished using the Dentamedica dosage for surgical applications, they can use half the dosage as a daily nutritional supplement. So when the patients take StellaLife Dentamedica, they need to discontinue taking any other vitamin supplements, and they would begin taking the Dentamedica either 4 or 8 weeks before the surgery, dependent on their risk factors. So patients who are diabetic, smokers, or any with chronic inflammatory diseases, they should start taking it 8 weeks before. And then all of the patients will take 2 capsules with a morning meal and 2 capsules with an evening meal. We want to make sure they take these supplements with food so that the nutrients get properly absorbed, and also to avoid a possible upset stomach when taken without any meals. We also want to ensure that there is a consistent blood level throughout the day and the night. And our bodies do absorb nutrients differently at night versus the day. So we do need to have them take these 2 doses. And they would continue taking the Dentamedica supplements either 2 or 4 weeks after the surgery, dependent upon their risk factors. We want to help your practice grow. So we will put your practice on our website under your zip code, and we provide you schedule widget. This is a complimentary service for our StellaLife doctors. You would normally have to pay for schedule widget, but with this, you're able to get people's contact information once you've linked your account with schedule widget. If they click on this tab, then you will get their contact info and when they would like to come in to see you. You can even set up pre-blocks to allow patients to schedule an appointment to come in to see you as a new patient through StellaLife and schedule widget. And that, of course, is optional. But we really want to help you get more foot traffic coming into your office. And I'll play this video for you.
StellaLife is on a mission to improve people's lives by accelerating healing, relieving pain, and reducing the need for opioids and steroids.
I can tell you that across the board, it's been an amazing experience for all of us, for my staff, certainly for me, and most importantly for our patients, because the feedback has been tremendous.
I've done over 150 cases and photo documented them. The healing at 1 week looks like 4 weeks.
We've been able to reduced the number of opioids that we prescribe in our practice almost fourfold in the last 3 years.
In the past, I would see wounds opening up, I would see membranes not only exposed but being lost, I would see bone grafts being lost, and can't say I would always attribute that to the chlorhexidine, but the use of the oral care program has just been really spectacular, and I love the overall wound healing that I'm seeing.
Where my assistants came to me and said, let's use this for every patient. Why? Because we're prescribing a lot less pain medications as a result.
It was a pure miracle, the difference in night and day and waking up without dry mouth.
Oh, this is the best product that I've ever had. I have a cancer patient with a melanodosis that is on chemotherapy. It's the only thing that allows her to eat.
We could not imagine practicing without StellaLife in our practice today.
So we want to help make this really easy for you and your patients. So we do recommend that the StellaLife products are incorporated into the procedure that the patient is going to be coming in for. So they would get one fee for the procedure. They would have their portion and the insurance portion if you do accept insurance, and have the StellaLife being part of that. So it's just part of the package. And if the patient has the flex plan at work with a flexible health spending plan, the recovery kit and the gel are eligible for HSA and FSA benefits. And we can share insurance codes with you for dispensing of these products as well. Just ask your product specialist or contact StellaLife. So we also want you to not have any concerns about using the products. So we offer an amazing guarantee. If you buy a case of any of the products and you decide it's not for you, you get to keep it and we'll give you a full refund, no questions asked. If you should dispense it to a patient and that patient doesn't like it for whatever reason, you will give them a refund and we'll replace the product for you. And if you should ever buy StellaLife products that expire in your office, we will replace expired products. We just don't want you to have any concerns about trying a variety of products on a variety of patients so you can really experience the benefits of these amazing products. So you also will always get 30% off. So you'll get professional pricing as long as you order at least one case. All of the products come in cases of 12. And so we want to just help you to enjoy these products and to get the best possible outcomes for your patients. So I want to share this QR code if you want to look at any of the research that we have on our website. This will take you right there. And these are the references of the research that was done for our probiotics. So I really want to thank you for spending the time today to learn about StellaLife. Don't hesitate to call us anytime, and also you may always contact your product specialist. Thank you, as we together can improve many people's lives.